On this Sierra, P0068 is an airflow correlation fault. The ECM is comparing the airflow it expects from throttle position against calculated airflow from the MAP sensor and measured airflow from the MAF sensor. In plain terms, the numbers may not agree. The truck may idle rough, feel lazy, hesitate, or set a warning light. And the possible fault areas often include the throttle body, MAP and MAF inputs, the air induction path, vacuum leaks, crankcase ventilation, exhaust restriction or leakage, and engine mechanical condition. The setting logic here is that actual airflow is greater than calculated airflow, so keep the diagnosis centered on why those airflow calculations do not line up. Start with the basic system checks, then follow a structured diagnostic approach before getting into the P0068 path. With the ignition on, first make sure there are no related reference voltage faults present. If one of those is set, handle that first, because a bad reference circuit can make the airflow comparison meaningless. If those are clear, look at throttle body idle airflow compensation on the scan tool. It should be less than 90%. If it is 90% or greater, the next direction is throttle body cleaning before continuing this fault path. Next, run the throttle sweep with the scan tool and watch the throttle position sensors 1 and 2 agree or disagree parameter. You want it to display agree. If it displays disagree, diagnose the throttle position correlation fault path first instead of continuing with P0068. If the throttle sensors agree, determine the vehicle testing altitude and compare the MAP pressure reading to the altitude versus barometric pressure range. If you do not have the needed pressure range for that altitude, pause, recheck the earlier diagnostic path, and avoid guessing. If the MAP value is out of range, follow the MAP performance fault path. If it is in range, move to the MAF check. At idle, use the scan tool snapshot. Slowly raise engine speed to 3000 RTM, then bring it back to idle. Review the snapshot frame by frame and make sure the MAF grams per second value changes smoothly and gradually. If it does not, follow the MAF performance fault path before continuing. Once those scan tool checks pass, reproduce the operating conditions for the monitor. For this fault, the monitor runs continuously once engine speed is greater than 800 RPM and ignition voltage is greater than 6.5 volts. Use the captured conditions if they help you duplicate the event. Then verify whether P0068 resets. If it does not reset, the result is all okay at that point. If it does reset, move into hands-on circuit and system testing, but only after completing the verification checks first. For hands-on testing, start by checking the integrity of the entire air induction system. Look for damaged, loose, collapsed, restricted, cracked, leaking, or incorrectly connected air and vacuum components. Check for an air restriction or restricted air filter, vacuum leaks around the intake manifold, MAP sensor, and throttle body, water intrusion, snow or ice buildup in cold climates, contamination on the MAF sensor element, crankcase ventilation problems, and missing, restricted, or leaking exhaust components. If crankcase ventilation operation is questionable, diagnose that system before moving on. If exhaust parts are missing, restricted, or leaking, diagnose the exhaust side before moving on. If you find a condition, repair or replace the affected component as appropriate. If the air induction and related systems check out, then test the engine for a mechanical condition. If a mechanical condition is found, repair or replace the affected component as appropriate. If no mechanical condition is found, the result is all okay. After the repair, keep verification separate from the testing you just performed. Verify the repair and confirm P0068 stays gone under the operating conditions. The takeaway is simple. Do not jump straight to a part. Prove the reference inputs are clean, prove the throttle, MAP, and MAF signals make sense, then inspect the air path and engine condition if the code returns. For more diagnostic training, visit stepdiagnostics.com.